Hello, I'm Dr. Jerry Mixon, and today I'm going to be talking to you about cholesterol. Now, cholesterol is a widely misunderstood hormone. Most people think of it as something bad, but it's not bad. It is, in fact, critical for life. Cholesterol is the mother hormone. All of those critically important hormones that keep us alive and healthy and vital are made out of cholesterol. The problem with cholesterol comes when it's damaged. And if it's damaged by high sugar or free radicals or radiation or any number of insults, it can be seen by your body as an inflammatory product, and then it gets sequestered, gets laid down, forms plaques. But healthy cholesterol is critical for a healthy, vital life. So let's talk a little bit about what cholesterol really is and what it does. First, it's required for virtually every cellular activity in your body, your brain, your muscles, your skin, your heart, your lungs, your kidneys. None of them work well without healthy cholesterol. Statin drugs are designed to lower cholesterol in an effort to reduce the incidence of cardiovascular disease and strokes. But in the process of interfering with your cholesterol metabolism, a fairly small percentage of people will develop significant side effects because the cholesterol metabolism is being interfered with, say, in their brain, in which case they start developing fuzzy thinking, memory problems, lapses. If it's involved in their muscles, they get weak, tired muscles, aches, pains, stiffness. So cholesterol interfering drugs can be a problem. At Longevity, what we've decided to do is to try to lower your cholesterol without using the statin drugs when we can. Now, about 90-95% of the time, we're very effective at lowering cholesterol without having to use the statins. But there is that small subset of people in which statins are important and are critical. So we use them when that happens. Cholesterol is turned into several other hormones. First, it's turned into pregnenolone. No, that's not progesterone, a different hormone. It's also made out of cholesterol. But first is pregnenolone. Pregnenolone is critical for sleep, for stress tolerance, anxiety. When your pregnenolone levels are low, you do not have a very happy life. You start getting fatigued. You can't sleep well at night. Anxiety just riddles your life. Dehydroepiandrosterone is also made out of cholesterol, and dehydroepiandrosterone is very important because it's a mood elevator. It makes you awake and alert and vital. It's also a mild androgen. It makes your bones thicker. It makes your muscles stronger. In women, it helps their bladder and their vagina to function much better so that they are successful in their intercourse. Cortisol, our acute stress hormone, and cortisol is also made out of cholesterol. And cortisol levels, when we get a serious injury or a painful insult, cortisol levels rise to kind of damp down the inflammation and help us to cope with the physical or emotional stress that we get. Unfortunately, if stressors last too long, chronic cortisol elevation can cause serious problems too. It can thin out your bones, make your muscles weaker, give you cataracts, cause neurons to die faster in your brain. So we don't want really high cortisol levels all the time, although little surges when we have trouble are very important. Progesterone is an important hormone for men and women. We're all aware that progesterone is used in the reproductive cycle. It helps ripen up the uterus and get it ready to have a baby. And then if you don't get pregnant, your progesterone levels drop, and that results in this sloughing of the endometrium, and that's what's causing that menstrual blood that you're all aware of. What's less known about progesterone is that it's critically important for men and women's skin. It helps your skin to be elastic and thick. It fills in those fine lines and wrinkles, and if you maintain adequate progesterone levels, you don't need Botox nearly as early. And it's even more important in men because it helps prevent the prostate from enlarging. Prostate enlargement is in fact directly related to the decline in progesterone that men experience with age. Young men have robust progesterone levels. It causes the alpha estrogen receptors in the prostate to act differently. When progesterone levels drop, those alpha estrogen receptors in the prostate start immortalizing the epithelial cells, and over time the prostate gets bigger and bigger and bigger, and that's what causes the benign prostatic hypertrophy that ends up interfering with the man's ability to urinate effectively, but also that chronic stretch on the bladder and the penile nerves that go around the bladder results in erectile dysfunction. So progesterone helps keep the prostate small and helps a man to maintain his sexual functioning. Testosterone is another hormone made out of cholesterol, and it is the primary sex hormone for men and women. Most people don't realize that young women have 2.5 to 3 times more cholesterol in their system than they have estrogen. Men, of course, have far more testosterone than women do. Testosterone, though, increases your bone density, men and women. Your muscles get firm and strong. It increases your drive, your ambition, your self-confidence, as well as your sex drive in men and women. Most women peak their testosterone about age 15, and it stays high through their early 20s, and then it starts to decline. And by the time you ladies hit 50, your total testosterone has dropped from 75 or 80 down to about 5 or 6. And that's why 70% of women have lost interest in sex by menopause. And it's not the loss of estrogen, it's the loss of testosterone. But testosterone also lowers the risk of breast cancer. Women who have their testosterone supplemented back up to youthful levels can reduce the risk of breast cancer by more than 10-fold. It also helps to rejuvenate and restore the stem cells in bone marrow in both men and women. Maintaining your testosterone levels is incredibly important for both men and women and for our health and healing. Elevated cholesterol puts us at risk for a wide variety of cardiovascular diseases, heart attacks, strokes, atrial fibrillation, congestive heart failure, etc. So at the next video, you're going to learn how we at Longevity Medical Clinic are able to lower the cholesterol in 90 to 95% of our people without having to use the statin drugs. If you're interested in protecting your cholesterol levels, getting them where they ought to be, and avoiding heart attacks, strokes, disabilities, etc., watch the next video. This is Dr. Jerry Mixon from Longevity Medical Clinic, and hopefully you'll be seeing a lot of these videos. Bye-bye.